Right now, noon, and we are interrupting programming for a local COVID update.
Let's listen in.
On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville-area government, healthcare, and our emergency response agencies, we bring you this briefing on our community's response to COVID-19. Our speakers today will be Mr. Jeff Sams, CEO of Huntsville Hospital, and Dr. Wes Stubblefield, District Medical Officer from the Alabama Department of Public Health. Before we go to our first speaker, I'll give the current numbers. In the state of Alabama, there has been 1,281,610 confirmed cases of COVID-19. In Madison County, 88,332, having resulted in 885 deaths. Current positivity rate in Madison County is 8.6%. At this point, we'll go to our first speaker, Mr. Jeff Sams from Huntsville Hospital.
Thank you, Jeff. I'm pleased to be here today with a fair bit of good news. In Madison County right now, there are 93 patients hospitalized with COVID-19. 83 of those are at the main hospital downtown, 3 of them at Crestwood, and 7 of them at Madison Hospital. Out of the 93, 21 of them are in the ICU and 15 on a ventilator. So hospitalizations have been declining rapidly, and we're delighted to see that. The almost 90 patients still in the main hospital, it remains a significant burden on the main hospital and causes delays in our ER. We are seeing those inpatients move through the system, but it'll take a few more weeks before it declines. In our health system, we have 132 inpatients right now, with 33 in the ICU and 21 on a ventilator. The majority of these inpatients continue to be unvaccinated, and COVID-19, despite the improvements, remains a very, very serious illness for vulnerable populations. And I'll highlight that in the last 2 weeks, we have had 22 deaths due to COVID. So those who are vulnerable, immunocompromised, it remains a very serious illness for those populations. Positivity rates in our lab has been running about 10%. That compares to a pandemic high of 44% and a pandemic low of 4%. And the positivity rate is also declining, another good indicator that the prevalence in the community is declining. Based on all that, I'm pleased to share that our visitation policy at the Madison County hospitals returned to normal last week. Generally, this means 2 visitors per patient, and the details are on our website. As I mentioned, the emergency departments continue to be extremely busy with a wide variety of illness and trauma, and the almost 90 COVID patients continues to cause delays in placing patients who need admission. Please, we encourage you not to come to the emergency department for routine testing or minor illness, and to use 911 only for true emergencies. If you're having COVID or flu-like symptoms, contact your primary care physician. Urgent care, walk-in clinics. Our fever and flu clinic on Governor's Drive is a good option, and the testing tent at Madison Hospital will remain open through March 7th. I'll also suggest that at-home COVID tests are an excellent tool to protect your family if you're having some minor symptoms and just want to make sure you're safe. The relaxed masking guidance from CDC was welcome news for many, but I would emphasize that masks remain an effective tool to protect your friends and family, both from COVID-19 and other airborne illnesses. We're seeing increased flu activity in the community. If you feel sick, wearing a mask is just a great idea to protect your friends. I'd also encourage people to continue wearing them when they're around a vulnerable population. If you're seeing someone who might be immunocompromised, protecting those who cannot protect themselves is the right thing to do. And I personally hope masks become commonplace in those situations, even as we all enjoy the opportunity to not wear them in other circumstances. Vaccination, briefly, continues to be a safe, inexpensive, and most effective tool to prevent severe disease. Vaccines are widely available in Madison County, and a bit of a milestone for our health system. We've been running the vaccine clinic at John Hunt Park for almost 2 years, first as a testing site, and then we've literally done over 100,000 vaccinations at that site. We're in the process of slowly ramping that down. We're open 2 days a week now, and we would expect over the next month to stop doing vaccinations at John Hunt Park based on the wide availability of vaccination in the community now. I'll just close by thanking the healthcare workers again. It's been a remarkable journey for everyone. It's not over yet. There still may be more chapters, but I can't stop without thanking the dedicated clinical staff, support staff, and physician community who have done everything possible to care for their neighbors during the pandemic. Physicians, nurses, EMS, respiratory therapists, pharmacists, housekeepers, food services, plant operations, and I could go on. These people have been doing this on a daily basis for 2 years. They're heroes in our community, and if you're friends with any of them, please thank them for their contributions. Thanks very much, Jeff.
Thank you, Jeff. Now we'll go to Dr. Wes Stubblefield from the Alabama Department of Public Health.
Thanks, Jeff. From Alabama Department of Public Health, we cannot be more pleased with the trajectory of these numbers. We currently are down statewide to a positivity rate of around 6%, which compares again to that high 40s that we mentioned before, and around 600 patients hospitalized statewide. We currently have no pediatric patients in the ICU and none on ventilators, which is welcome news. We continue to have at all county health departments testing and vaccination availability. So if you need a vaccination, please seek that out. As Jeff said, that thinking about moving forward with this pandemic, he did mention the new community levels as opposed to what had been the community risk of transmission. We are in the process of updating our dashboard to reflect those community levels so that we have the best information going forward. In terms of masking, the masking, there will be people that need to mask and should mask, as already been mentioned. I would encourage the public to remember that behind every mask is a story, and for those adults and children who are masked to realize that they are masked for a reason. From the Alabama Department of Public Health, again, thank you, as mentioned before, thank you to all the healthcare providers and what we've done to get this point in the pandemic. The COVID-19 will, as most experts think, will never disappear. But we will learn to live with this virus. We will learn to protect those that are most vulnerable, and to keep our children in school and to keep our community going, our businesses thriving is always been the goal of public health. And so as we move forward, we thank the community for our progress and for what we've been able to do together, and we're looking forward to a new chapter for Alabama.
Thank you, Dr. Stubblefield, and thank you for watching today. Just as a note, this will be our last regularly scheduled briefing. Until then, as always, you'll be able to get COVID-19 updates with the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Till then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. Please, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good afternoon, Dallas Parker of News 19. My first question, lots of good news today here, but the last time things seemed to be calming down, within a few weeks we saw a new variant and another spike. How likely is this to happen again?
At this point, we are monitoring for future variants. The CDC and the Alabama Department of Public Health are currently involved in making sure that we catch any of these quickly. We are not seeing anything at the moment. We do know that many have heard of the Omicron BA2 variant that is out there, and we're monitoring that, although those percentages have been very low in the United States. So currently, we're cautiously optimistic about the upcoming weeks to months.
Gotcha. My follow-up is for Mr. Sams. The president last night talked about an antiviral pill that will be given immediately after a positive test. I know a lot remains unknown about that, but in a perfect world, what impact would something like that have on hospitals? I know you say ER is swamped still.
In a perfect world, it's a wonderful tool to help manage. So when you use so many more tools now than when the pandemic started. We have at-home tests, we have widely available testing, vaccination, but the opportunity to go get tested in a pharmacy or in your doctor's office and then go get a very effective tool that, I'm not a physician, but in my understanding, it's almost as effective as the monoclonal antibodies that have been used so effectively. To be able to get that treatment on your own and go home and get better is just a wonderful tool that could help us avoid and manage future surges. I think we all believe there may be a future surge. We just hope the surge is a bump and not a cliff, and doesn't put the strain on the community healthcare resources that causes such a disruption in everybody's lives. So I think those treatments could be a very important part of that response.
Thank you.
Hi, Lee Roop with AL.com. Thanks for doing this, gentlemen, and thanks for doing it all through the pandemic. It was really helpful. So I'm probably just confused, but the CDC site looks to me like they're saying to me today that we're still high in Madison County and that I should be wearing a mask indoors. Are we high in Madison County and I should be wearing a mask indoors, or?
So, so with the community levels that the CDC has currently published, if you go to the CDC website and pull down the county, each county will be given a low, medium, or high risk. And in high-risk counties, which Madison, I know as of yesterday, was still high, it is recommended to mask indoors. At medium and low levels of community, the medium and low levels at the community level, the masking is recommended, especially for those that have high-risk medical conditions. We probably will see those numbers change, although they're supposed to be updated weekly. They're not updated daily. And the Alabama Department of Public Health is currently investigating how we can move this to a daily update using both CDC numbers and Department of Public Health numbers.
Okay. So to follow up, we are high, but we're moving kind of in the right direction, it sounds like?
Yeah, correct. So all of Alabama's counties are definitely moving in the right direction. We see that statewide. If you look at our dashboard, which I know is on the previous, low, moderate, substantial, high, many counties have, and it's statewide, we've dropped down to that moderate level, and we're now seeing even counties that are in the low category. So we're definitely moving in the right direction across the state.
And I'll just add to that, the data we see about demand for testing, those kind of early indicators of what's going on in the community, they've all fallen back to the lowest points. So I think it's it may technically be high risk in the community, and we've always followed CDC recommendations. So I'm not saying we shouldn't. We've always followed those. But I think it's a matter of time before that data catches up with what we're actually seeing in the community.
Thank you.
At this point, we'll end. Go ahead, I'm sorry.
Eric Channel 48 News is for you, sir. The state is about to adopt the CDC's way of measuring COVID in a community, but comparing to the 2 days, there are differences and discrepancies. It seems communities with hospitals have higher COVID numbers than those that don't, and it may be giving a false status for those communities without a hospital that actually may have higher COVID numbers than are reflected. How will those discrepancies between the CDC and the state be reconciled so that we have true understanding of COVID in certain communities?
That's a great question, and I can tell you that our epidemiologists, our data analysts, and our health officers are all currently involved in that exact conversation about how we move forward with making these numbers relevant for our state. The CDC picked numbers that they could aggregate nationwide and not things that are specifically state focused. So they wanted something that would be applied to all counties and all states. We feel that our data are more accurate and more timely than CDC's data. And so we're working very quickly to hopefully reconcile both with CDC in the beginning, but then also moving towards something that would mirror CDC, but also be a little bit more timely.
Thank you.
You're welcome.
All right, at this point, we'll end this briefing. Thank you for coming.
And you've been listening there to Huntsville and Madison County health leaders giving us an update, a final update, at least for now, regarding the COVID pandemic. Perhaps that is among the best news we've heard out of that. The fact that there will be no more of these, at least scheduled for now, is a clear indicator those numbers are dropping. And the reason they do these is because people need a regular update because the numbers were high for a while.
Right.
Other good news, 93 people battling COVID in Madison County hospitals. 21, only 21 in intensive care, only 15 of those on ventilators. none of those are children. Really different story than what we were reporting just a couple of weeks ago.
And health leaders were also saying that we still need to keep our guard up a little bit, still wear a mask indoors when you do seem that it is necessary. They were also saying that John Hunt Park, which has been giving out vaccines for the past 2 years, they actually might stop distributing vaccines because there are so many readily available. And they did also ask that people be conscious of the ERs still. They are overwhelmed, and that's something people need to be aware of. Only call 911 if it truly is an emergency.
Also, a reminder to folks, you know, we do see people and school systems saying we're going to make these masks optional now, but these health leaders saying, do remember, if you're not feeling well, it would be best to put on a mask just in case. That protects the people around you. And also, if you're around people you know have compromised immune systems, go ahead and put that mask on still, because there are still people we do need to protect from any possibility that that COVID and any of its strains, including of course the Omicron strain, could still be out there and affect them in a very bad way.
Yeah, Wes Stubblefield had made that point that there's a story behind every mask, and you just don't know if people are wearing a mask for a certain reason, so you have to be mindful of that. But we're going to break it all down for you at WAY 31 Evening News at 4, 5, and 6 o'clock.
For now, we return you to regular programming. Thank you. Have a great afternoon.